Good morning, and welcome to Life Science Cares Philadelphia's first in a series of webcast interviews with leadership of our nonprofit partners. For those who don't know me, I am Pete Wolf, Executive Director of Life Science Cares Philadelphia. We decided to hold these webinars in order to highlight how COVID-19 has impacted the vulnerable communities served by our partners, as well as how our partners have responded to the crisis. The webinars also serve as a way for us to stay connected with our nonprofit partners at a time that we can no longer care actively by volunteering. We are recording the webinars so that our life science colleagues who could not join us today will have an opportunity to watch at a later date. We also encourage you to share the recording with your organizations. This morning, we are fortunate to be joined by our special guests, Mike Dahl, the Executive Director of Broad Street Ministry, and Lisa Dalton, the Chief People Officer at Spark Therapeutics. Mike will share with us how the COVID-19 pandemic is impacting our community and how Broad Street Ministry has modified its operations in light of the crisis. I think our life science community will appreciate the agility with which Broad Street Ministry adapted to the new circumstances, as well as the innovative collaborations Broad Street Ministry has entered in order to provide an expanded range of services to those in need. Next slide. As many of you know, Life Science Cares was founded in Boston and expanded to Philadelphia at the end of 2019. We at Life Science Cares are working to unite the life science industry in order to improve the lives of our neighbors who are impacted by poverty. We do this through a collective effort to provide human and financial resources to our nonprofit partners. As we got started here in Philadelphia, we held over 7 volunteer events which engaged nearly 80 of our life science colleagues. Unfortunately, the COVID-19 pandemic ended our volunteer opportunities this March, and we shifted our focus to providing needed financial support to our partners. Just last month, we made $100,000 in emergency grants that supported our partners' efforts to respond to the COVID-19 crisis. Today, we are actively engaged in additional fundraising efforts that will allow us to make up to an additional $200,000 in grants. We'll share a bit more about how you can help after we hear from Mike. At this time, I would like to welcome Lisa Dalton, the Chief People Officer at Spark Therapeutics. In this role, Lisa oversees the core functions of HR, IT, finance, and corporate communications, and is also a key part of the COVID task force and community outreach effort at Spark. In addition to her formal roles at Spark, Lisa is a member of the Life Science Cares Board of Advisors and one of the many Spark employees who volunteered with us earlier this year. Lisa?
Thank you, Pete. We're really excited to host the Life Science Cares inaugural webinar. Spark Therapeutics is a gene therapy company based here in Philadelphia, and we are committed to discovering, developing, and delivering gene therapies. Our mission statement sums it up perfectly. We challenge the inevitability of genetic disease in the areas of blindness, hemophilia, lysosomal storage disorders, and neurodegenerative diseases. When the COVID-19 pandemic started to unfold, Spark's first course of action was focused both on the safety of our employees' well-being and safety, as well as the patients in our clinical trials and the patients waiting to be treated with gene therapy. Like all organizations, we had to adjust quickly to working from home and all the new and interesting challenges that has brought with it. We're incredibly proud of the resilience that our employees have demonstrated and how much they have risen to these challenges and continued to be committed to our mission. Once we had our employees, patients, the business somewhat under control and taken care of, we did turn our attention then to the community. Spark has always had a strong focus on the community here in Philadelphia. Over the years, we've provided volunteer hours, material goods, and financial contributions. When the community asked for help supporting efforts specific to the COVID-19 pandemic, this was an extension of our ongoing commitment. We tried to take a strategic and holistic approach and make a big impact through organizations that aligned with our philanthropic areas of interest, such as STEM education, the Philadelphia community, and healthcare. The resulting response was built on the following 3 pillars. The first pillar was the donation of goods and services, and specifically the personal protective equipment, or PPE, that was so much in need. As a gene therapy company with labs in our own licensed manufacturing facility, we had access to critical supplies, and we felt it was important to donate the PPE, disinfectant, other lab supplies to our neighbors at Penn and Penn Presbyterian to help protect the workers on the front lines. Our second pillar was focused on community action and volunteerism. At Spark, we encourage employees to become involved in the community, and during this time, we continued to encourage them to donate blood safety via the Red Cross. And like many other healthcare companies, we offered our employees with a medical background who wished to volunteer no disruption in pay, benefits, or their services at Spark. Next slide, please. Our final pillar is financial contributions, which of course encompasses a bit of each of the other pillars. When it came to financial contributions, Spark employees were incredibly enthusiastic about wanting to give back. Many surfaced ideas directly to senior leadership, and we really leaned into this. In addition to creating a framework for donations, we gave employees the opportunity to vote and help direct some of where the contributions were going to go. Great examples of this included our employees participating in a virtual food drive to provide additional resources to our partners at Philabundance, donations to the city's Philadelphia COVID-19 fund, and the fund for the school district of Philadelphia. We also offered employees the opportunity to direct donations to organizations like Year Up Students to support college-age students facing food insecurity. In total, more than 8 organizations and COVID impact funds were reached, including our continued support of Life Science Cares. Life Science Cares has been a tremendous partner during this pandemic, as well as a key partner to our employee volunteering program. Their work leverages the collective impact of the life sciences industry, which enables them to move quickly to get resources where they are needed now in the community. Next slide, please. This is a great entry point to introduce Mike Dahl, the Executive Director of Broad Street Ministry. I had the opportunity to volunteer and serve guest meals at Broad Street Ministry in January, where we served over 400 meals that day. And I have seen firsthand the impact, the tireless efforts of your staff, as well as the impact of your organization has had on the community. The personal connections, the warmth, and the dedication of your organization were all very impressive. So thank you, Mike, for your time, and we're looking forward to hearing what your team has been up to in the community during this unprecedented time and how we can help.
Good morning, everyone. First of all, I want to express my gratitude. Life Science Cares was one of the very first organizations that reached out to us when the crisis hit. And their support and their compassion was truly touching, and came in at a time when we desperately needed the help to keep our doors open. So I will always be grateful to Life Science Cares for being there for us during this moment. So before we go any further, I want you all to take a step back and think about the concept of home. What does the idea of home bring up for you? So Maya Angelou once said, "The ache for home lives in all of us, the safe place where we can go as we are and not be questioned." Now I want you to think of 2 questions that, for me as the executive director at Broad Street, I've had to wrestle with over and over again over the past few weeks. That first question is, when the entire world is being asked to shelter at home to ride out this pandemic, what do our neighbors who have no homes do? And then the second question is, when your entire organization is geared to serving as that one place where our vulnerable neighbors can go, where they can always feel welcome just as they are, where there is always a seat at the table, where we strive to provide that safety and security of home, what do you do then when you can no longer welcome your guests into your building in large numbers? Because in essence, that's been the challenge for us that's been created by this pandemic. So at Broad Street Ministry, our purpose, our mission is to provide radical hospitality to our most vulnerable neighbors. And for us, it had always begun with an invitation to the table. We're known for serving these beautiful meals that Lisa was talking about. We serve them in our sanctuary. I have a professional chef team that prepares them. The first time I volunteered, it was vegetable ratatouille over polenta with a balsamic reduction. We serve them tableside with linen and china. It's a restaurant-like experience. because we believe that everyone is entitled to be treated with dignity and respect. So we also provide a mailing address for over 5,000 people each year who have no other place to call home. All right. Good morning, everyone. First of all, I want to express my gratitude. Life Science Cares was one of the very first organizations that reached out to us when the crisis hit. And their support and their compassion was truly touching, and came in at a time when we desperately needed the help to keep our doors open. So I will always be grateful to Life Science Cares for being there for us during this moment. So before we go any further, I want you all to take a step back and think about the concept of home. What does the idea of home bring up for you? So Maya Angelou once said, "The ache for home lives in all of us, the safe place where we can go as we are and not be questioned." Now I want you to think of two questions that, for me as the executive director at Broad Street, I've had to wrestle with over and over again over the past few weeks. That first question is, when the entire world is being asked to shelter at home to ride out this pandemic, what do our neighbors who have no homes do? And then the second question is, when your entire organization is geared to serving as that one place where our vulnerable neighbors can go, where they can always feel welcome just as they are, where there is always a seat at the table, where we strive to provide that safety and security of home, what do you do then when you can no longer welcome your guests into your building in large numbers? Because in essence, that's been the challenge for us that's been created by this pandemic. So at Broad Street Ministry, our purpose, our mission is to provide radical hospitality to our most vulnerable neighbors. And for us, it had always begun with an invitation to the table. We're known for serving these beautiful meals that Lisa was talking about. We serve them in our sanctuary. I have a professional chef team that prepares them. The first time I volunteered, it was vegetable ratatouille over polenta with a balsamic reduction. We serve them tableside with linen and china. It's a restaurant-like experience because we believe that everyone is entitled to be treated with dignity and respect. So we also provide a mailing address for over 5,000 people each year who have no other place to call home. So this was the model that was in place all the way up until February, until the stay-at-home orders came into place. So what do we have to do? The first challenge, honestly, is how could I just stay open? How could we just keep our doors open? And immediately we shifted our focus to go to the bottom of Maslow's need hierarchy. What were the most essential services that we needed to keep doing to help help the city in this moment? And it really came down to three core services. It came down to the meals. It came down to that mailing service, because if you don't have a home and you don't have a bank account, the only way you can receive benefits, a stimulus check, food stamps, the only way you can get those is by having a mailing address. And we are the only place in the city right now where anyone can show up and get a mailing address. And the third thing that we had to focus on was personal hygiene. Every week, when we hand out personal hygiene items, simple things like socks, underwear, soap, toothbrush, toothpaste, feminine hygiene items, adult diapers, every time we hand those out, it's our biggest day of the week. Because these are items that are very expensive for people who are in deep poverty, but it's very difficult to live a dignified life without them. And so we knew we had to continue to focus on personal hygiene. But then something started to strike us, which was the numbers started going crazy. We were serving on average anywhere between 300 to 350 people a day right before the crisis. Immediately, that number went to 400, then it went to 500, then it started reaching up to 600. And it was people coming in desperate for food. I am not exaggerating when I tell you that the levels of hunger we are seeing in Philadelphia right now are levels we haven't seen since the Great Depression. The second thing that was really struck us was people were desperate just to get to our bathrooms. The city had shut down, facilities had shut down, places had shut down, and people couldn't even exercise the single most basic preventative measure that everyone was telling us to do, washing hands. So what did we do? We started a campaign to put hand washing stations across the city in locations where there's a lot of unhoused people, because everyone deserved to be able to try to protect themselves. And so we now have 14 hand washing stations located across the city, and they're serviced every day. We're estimated that 10,000 people per week now are using these hand washing stations, just so people could do the simple, most basic thing of trying to protect themselves from the virus. We did one more thing with the hand washing stations, and we wanted to provide one more thing that our guests very often don't have. And what's that? It's visibility. This population, people suffering from deep poverty and hunger and homelessness, people wrestling with mental illness and addiction, they're very often invisible. They often are not acknowledged. So we teamed up with Mural Arts to create these big, beautiful murals to go along with the hand washing stations. They're vibrant, they're created by local artists. And then we went out and we started a media campaign just trying to get people to focus just on that simple question of what do you do if you can't shelter at home because you have no home? So that was the early days. We focused on the core services, we focused on creating the hand washing stations, but very quickly those numbers that I talked about, the numbers of people coming in started to overwhelm our facility. We operate in the big church across from the Kimmel Center. Well, let me just put it this way. We were handing out 250 meals in the first 15 minutes of operation. People were rushing in just to get the meal. Then they would get our meal, and then they would rush over and try to find another place to get a meal just so they could get their basic needs, their caloric needs met each day. And I had this kind of moment of truth, knowing that, having that many people rushing into a church basement with poor ventilation, I wasn't doing well at keeping my guests safe. And more importantly, I wasn't, not more importantly, but equally importantly, I wasn't keeping my staff safe as well. We couldn't practice social distancing in any kind of rational way. And this moment of truth was, we either had to find a new way of operating, or I had to shut down. I would have had to shut down, go back to a skeletal staff. I was going to have to furlough workers. I was going to have to cut salaries. And as you look around, this is the path that, quite frankly, a large number of nonprofits have had to take right now, particularly those that rely on ticket sales and other things for revenue. But for me, that would have been a dramatic failure, and so there had to be a better option. So what I did is I got on the phone with two of the smartest people and two of the most dedicated people I know in the city. Sister Mary Scullion of Project Home and Jose Benitez at Prevention Point Philadelphia in Kensington. And we had this long kind of conversation of saying, is there a way that working together, we could provide a better service for the populations that we all serve than we could alone? And how could we keep the critical things of meeting the healthcare crisis continuing, but also meeting the dramatic hunger crisis that was spawned by the healthcare crisis? How could we meet both of those needs together in a better way? And what we came up with was the idea of creating these outdoor service hubs. So I knew I needed to move the meal outside so that I could have large space in order to socially distance people, but I also knew I needed to be near a healthcare partner, because the single best time to screen and test people and to identify who was positive are those meal times, because you know where the population is going to be at. This is not an easy population to find, and it's not an easy population to serve, but we knew where they were going to be at least once a day, and that was lining up for the meals. So I needed to have a healthcare partner. The other thing that we needed at this point was those spaces. I needed wide open spaces. I needed to have physical barriers so I could socially distance. I needed sanitation help. I needed help with crowd control and de-escalation. So what I needed is I needed the city to get on board. So working with Prevention Point and Project Home and Brush Group Ministry, we called the city. We took it straight up to the Deputy Mayor, Ava Gladstein for Health and Human Services, and to Liz Hirsch, the Director of Homeless Services. And we pitched an idea which we called the Step Up to the Plate campaign. There's no business, there's no base. If you love it, that was my idea. And if you hate it, I'll say somebody else came up with it. But what Step Up to the Plate basically did is to say, let's create these hubs in critical locations across the city where we know there's large numbers of unhoused people. So Center City, Kensington, South Philly, where there's a really hard-hit immigrant community, were the three core locations. We had a couple of other challenges. We needed to have somebody make the meals, because one of the things I had to do when the crisis hit was to stop bringing in volunteers and take all of my staff and put them on the front line. So my kitchen staff was now out on the front line and not making meals. So the mechanism we thought of was the simple idea of there was so much catering and restaurant capacity that was going idle. Restaurant and catering workers, hourly workers who were being put out of work, we said, let's use that capacity to make the meals, and let's pitch having them do it at cost so that we can afford it. And we can get beautiful meals made, but we can also put some of those hourly workers back to work making the meals. And the other challenge we had was how are we going to spread people out? Can the city provide us with these big locations? And that's when a really, really beautiful thing happened. It was about, and over the course of about 10 days, we had these conversations, and everyone came together with this tremendous spirit of cooperation. The city was on board. And when I say the city was on board, I'm talking about not only Office of Homeless Services and Department of Health and Human Services, but the Sanitation Department, the Philadelphia Police Department, the Sheriff's Department, the Office of Emergency Management, facilities at the city. Every part of those people, every one of those departments started saying, okay, how do we make these hubs happen? The caterers came on board, led by Peter Lovey at the Catering by Design, but we got Catering by Design and Garces and 12th Street Catering and Cook and Solo. I mean, I have these blue chip caterers making really beautiful meals, which for us is part of the equation, because radical hospitality means providing the best to those that have the least. The nonprofits came on board with Prevention Point and Sister Mary. We started working with other ones out in other areas of the city, face-to-face in Germantown. In South Philly, we're working with CMAC, but everyone coming in. And then the last piece of the equation is we had to fund it. So we had to pitch it to the philanthropists. And we were able to raise, well, we're up to about 1.9 million now in support of the Step Up to the Plate effort from local philanthropy. So the bottom line is Step Up to the Plate right now is serving over 2,500 people every day. And they're serving them, these are our neighbors who are truly at the most risk right now in the pandemic. These are our neighbors living in deep poverty with homelessness and hunger. These are neighbors wrestling with addiction and mental illness. And we're serving in those three core sites. Center City, we're serving in the north apron of City Hall, right across from the Municipal Services Building. In Kensington, the pictures on your screen, we're serving in a huge parking lot that's owned by the city. And in South Philadelphia, we're serving at the Francis Scott Key Elementary School, which is a very trusted institution for many of the immigrant populations. We're also serving in about 6 other locations in the city where people were providing meals, but they were no longer able to create those meals themselves. So in Germantown, Nicetown, in North Philly, really across the city. And we're getting meals out to the most vulnerable populations in the city. So I guess at this point, I'll say that the last point, and before we open up for questions, is everything we've done to now has been kind of in this crisis response mode. How do we help address the most immediate crisis? But quite frankly, we're entering into another phase. We are now starting to wrestle with, all right, once the immediate crisis passes, what does the new normal in Philadelphia look like? And I have to tell you, if you're sitting in my shoes, it looks like things are going to be incredibly challenging. You have to understand 1.5 million people in Pennsylvania have filed for unemployment, and economists are telling us that 40% of those jobs are not going to come back. That just means that the demand for places like Broad Street Ministry, for Project Home, for Prevention Point, the demand on the social services industry is going to be going through the roof. And this is at the same time as the mayor is forecasting that the budget for social services is going to have to go down 20%. So I have challenged my staff now to say, oh, and the virus is not going to go away in August or September. It's going to be with us. So the need for social distancing, the need to take preventative measures, the need for PPE, are all going to be with us come September, October, November as well. So our challenge now is to think through, what does it mean to provide radical hospitality in that new normal? And we're having to rethink every aspect of our operation, even something as simple as distributing clothes. Because we used to distribute clothes in this set up a clothing closet that looked like a store, but I can't have a bunch of people in an enclosed space with no ventilation anymore. So I'm going to have to find another wide open space to put the clothes out so people can use them. Congregant meals. I don't think I'll go back to doing these beautiful meals in my sanctuary anytime before January. So literally everything that we did, case management, which is trying to help people get access to all of the things that will get them back to stability, housing, drug treatment, overdose prevention, employment. We have case managers who are experts in hooking people up with all these downstream services, but that was a very one-on-one kind of experience. So we're having to move our case management into a call center so people can do it online. Do it through telephonically. And we're having to hand out cell phones to people that don't have them so they can actually call those case managers. So that's the world that we're forecasting, and that's the world that we're looking at right now, which is how do we welcome people and treat them in dignity when we can only have a limited number of people in the building and when we have to stay 6 feet apart and we're all wearing masks. So that's the world that we're going to go through. But I'll tell you one thing, knowing my team and knowing my board, we're going to do it. We have already had to pivot a number of times for this crisis, and we are going to do so again, because in all honesty, our most vulnerable neighbors deserve nothing less than our very best efforts. So once again, tremendous gratitude to Life Science Cares and to organizations like Spark that show compassion for our most vulnerable neighbors. They're our partners in this battle, and we could not have kept our doors open without them.
Hi, Mike. Thanks for that. I think we will move on to just wrapping up. But as Mike mentioned, you can imagine that all of these activities and changes have economic costs, and all this is at a time that there is not an opportunity to bring in volunteers currently. So that is why Life Science Cares Philadelphia is actively raising additional funds to enable additional emergency grants. And at this time, you or your organization can currently double the impact of donations to Life Science Cares as we are in a position to match donations up to our goal of raising an additional $100,000. These funds will allow our partners, including Broad Street Ministry, to assist, as Mike described, the most vulnerable among us in our community. If you are interested in donating, or if you have ideas how our life science community can contribute in other ways, please reach out to me. Moving on to the next slide, you can see these are our partners that we hope to be able to assist with additional emergency grants in the coming weeks. I'd like to thank Mike and Lisa and everyone who listened to this program, and a special thanks to the Spark Therapeutics and all of their employees who have helped support this webcast, their employee volunteers, and for their financial support. We will be having additional webcasts, and we hope that you will be able to join us for our next webcast, which will be held Wednesday, May 27th, also at 9:30 a.m., where we will be joined by Michael Smith, the Executive Director of Cradles to Crayons Philadelphia, and Vin Milano, the CEO of Idera Pharmaceuticals. Thank you again for your support of Life Science Cares Philadelphia, and we hope to see you again soon.